Did you know that you can lose up to 2 liters of water per hour in cold weather, even if you don't feel thirsty or sweat? This can lead to a dangerous condition called cold weather dehydration, which can affect your physical and mental performance, and even put your life at risk. In this video, we will explore what cold weather dehydration is, how to recognize its symptoms, how to prevent it, and how to treat it. Stay tuned and don't forget to hydrate. So what is cold weather dehydration, and why does it happen? Cold weather dehydration is when your body loses more water than it takes in, and your blood volume and fluid balance are disrupted. This can affect your physical and mental performance, and even put your life at risk. There are several reasons why cold weather dehydration happens. First, cold air reduces your thirst sensation, so you don't feel the need to drink as much as you should. Second, cold air increases your water loss through breathing, as your lungs have to humidify and warm the air before it enters your body. Third, cold air makes you urinate more, as your body tries to conserve heat by constricting your blood vessels and reducing blood flow to your extremities. Fourth, cold weather clothing and equipment can add weight and bulk, making you work harder and sweat more. And fifth, cold weather can make it harder to access water sources, or make you reluctant to drink cold fluids. All these factors can contribute to cold weather dehydration, which can have a range of symptoms and effects. Some of the most common ones are dry mouth, thirst, and reduced saliva production, headache, fatigue, dizziness, and confusion, low blood pressure, rapid heart rate, and irregular heartbeat, muscle cramps, weakness, and reduced endurance, nausea, vomiting, and loss of appetite, chills, shivering, an increased risk of hypothermia and frostbite, impaired judgment, decision-making, and coordination, decreased immune system function, and increased risk of infections. As you can see, cold weather dehydration can affect your whole body and mind and make you more vulnerable to injuries and illnesses. That's why it's so important to prevent it and to treat it if it happens. So, how can you prevent cold weather dehydration? Here are some tips and advice that can help you stay hydrated in winter. Drink enough water and fluids throughout the day, even if you're not thirsty. Aim for at least 2 liters per day or more if you're active or exposed to extreme conditions. You can also drink warm beverages, such as tea, coffee, soup, or hot chocolate, to keep you warm and hydrated. But you should avoid drinking too much alcohol and caffeine, as they can dehydrate you further and impair your body's ability to regulate temperature. Use oral rehydration salts, or ORS, to replenish your electrolytes and minerals. ORS are packets of powder that you can mix with water and drink. They can help you prevent or treat mild to moderate dehydration and restore your fluid, balance, and pH. You can buy ORS at pharmacies or make your own at home by mixing 6 teaspoons of sugar, half a teaspoon of salt, and 1 liter of water. Wear appropriate clothing and equipment for the weather and your activity. Choose layers that are breathable, moisture-wicking, and insulating, and adjust them as needed. Avoid cotton, as it can absorb sweat and make you wet and cold. Wear a hat, gloves, scarf, and boots to protect your head, hands, neck, and feet from heat loss. And use a backpack, belt, or vest to carry your water and other essentials. Monitor your sweat rate and body temperature. You can estimate your sweat rate by weighing yourself before and after your activity and calculating the difference. For every kilogram of weight loss, you need to drink about 1.5 liters of water to rehydrate. You can also check your body temperature by using a thermometer or by feeling your forehead, chest, or back. If you're too hot or too cold, you need to adjust your clothing, activity, or water intake accordingly. Check your hydration status by looking at your urine color and skin elasticity. Your urine color can indicate how hydrated you are based on a scale from clear to dark yellow. The clearer your urine, the more hydrated you are. The darker your urine, the more dehydrated you are. You can also test your skin elasticity by pinching the skin on the back of your hand and seeing how fast it returns to its normal shape. The faster it returns, the more hydrated you are. The slower it returns, the more dehydrated you are. These are some of the ways you can prevent cold weather dehydration and keep your body and mind healthy and happy in winter. But what if you or someone else becomes dehydrated, despite your best efforts? What should you do then? Here are some steps you can take to treat cold weather dehydration and to avoid its complications and dangers. Stop the activity and find a warm and sheltered place. If you're dehydrated, you need to rest and recover, and avoid further exposure to cold and wind. If possible, find a place where you can sit or lie down and cover yourself with blankets, coats, or sleeping bags. If you're with someone else, you can also share body heat by hugging or cuddling. Rehydrate slowly and gradually. Don't drink too much or too fast, as this can cause nausea, vomiting, or water intoxication. Drink small sips of water or ORS every few minutes until you feel better. You can also suck on ice chips, candy, or gum to moisten your mouth and throat. Avoid drinking alcohol, caffeine, or carbonated drinks, as they can worsen your dehydration and symptoms. Seek medical attention if needed. If you have severe dehydration, or if your symptoms don't improve or worsen, you need to get professional help as soon as possible. Severe dehydration can lead to shock, kidney failure, or death, and requires intravenous fluids and medications. Call 911 or ask someone to call for you and explain your situation and location. Don't wait until it's too late, as every minute counts. These are some of the things you can do to treat cold weather dehydration and to save yourself or someone else from a life-threatening situation. Remember, cold weather dehydration is a serious problem, but it can be prevented and treated with proper knowledge and action.